It's not cholesterol that causes heart disease. It's all due to inflammation. That is fake news. Let me show you something. First off, when we're talking about heart disease, we're talking about atherosclerosis or plaque buildup that can lead to heart attacks, right? And this is what I treat for a living. Here's an example of an angiogram of a patient with a 99% blockage in their left anterior descending artery. And we implant the stent to push away all that yucky atherosclerosis to reestablish blood flow. And the whole point of prevention is to prevent them from developing this blockage from the first place. Now here's a cross-section from someone's coronary artery who died of a heart attack, and we are able to examine these atherosclerotic plaques. And what do we notice in patients with heart attacks? They have lipid-rich cores, meaning there is lipids in that artery wall, lipids being cholesterol. When I do coronary angiograms, we can actually image the inside of the arteries in live patients, just like this. And again, what you see here is lipid-rich plaque, and we can use the characteristics of the light that we use to image these to determine that. So what about inflammation, you ask? Yes, inflammation is important in developing heart attacks and atherosclerosis in the walls of the artery, but guess what? It's the LDL particles or the ApoB particles that are getting inflamed and oxidized to lead to the plaque buildup. So if you don't have the building blocks of the cholesterol, you're not going to develop the arterial blockages even with inflammation. Moreover, quantifying, understanding that type of inflammation is very challenging. We don't know a lot about that. What we do know a lot about is LDL cholesterol and its relationship to developing heart attacks. I mean, just look at the data. We have so much data of hundreds of thousands of patients, almost 1 million patients in totality of different types of studies looking at the magnitude of lowering your LDL and its relationship to reducing cardiac events. This is very strong evidence and data that meets criteria for causation. So if you're not buying this, there are very few things in medicine that's going to have a level of evidence that you're going to believe. Now here's data from multiple LDL lowering trials showing that the lower your absolute LDL level gets, the lower your cardiac event rate is. It's almost linear. We also have studies showing that the lower your LDL gets, the smaller the plaque volume is when we image these coronary artery plaques. Less building blocks for atherosclerotic plaque, smaller amount of plaque. Bottom line is we know that high cholesterol leads to coronary artery disease. Certainly there are many other risk factors at play, diabetes, hypertension, family history, and everyone's thresholds for how much cholesterol it can handle is different. And of course there is a contribution of inflammation, which is difficult to, again, quantify. But the bottom line is the building blocks of these plaques is cholesterol lipids. Without it, you're not going to get it.